My name's Morphia Piri. I'm a customer research advisor at Doability. And at least for this particular session, I will be your moderator. It's quite an exciting event that we have and quite packed. And we're looking forward to the presentations that we have. As Linda mentioned, our two presenters have been have been working with us through the research grant that they received. And we are excited to see the fruit of that work, even through the presentations that we're going to have. Our two presenters are firstly Elizabeth. So Elizabeth is a postdoctoral associate at Yale Child Study Center and holds a PhD in global health and population with specific focus on applied statistical analysis in the field of early child development, also for short ECD, from the Harvard University. Before beginning her PhD, Elizabeth completed her master's in global health at Harvard and her bachelor's in science from the University of Michigan. Previously, Elizabeth has worked on maternal and child health-related research projects in Tanzania, Uganda, Kenya, Vietnam, India, and Pakistan, with a specific focus on ECD in low and middle income contexts. Elizabeth utilizes both quantitative and qualitative methods to evaluate and develop technical techniques to better understand measurement pathways that influence children's early development. Elizabeth has consulted for the World Bank and for the World Health Organization, and she's deeply interested in psychometric measurement, program evaluation, and interdisciplinary collaboration. So excited to hear from Elizabeth. Our second presenter will be Duncan. So Duncan is a PhD student in economics at the Paris School of Economics. He is a development economist who uses tools and insights from behavioral economics and whose current projects focus on discrimination, social change, and human capital. He spent 2022 to 2023 as a visiting scholar at MIT and 2021 at US Berkeley, and is a Global Priorities Fellow supported by Forethought Foundation. Later this year, Duncan will be joining Princeton University as a postdoctoral scholar before joining Nova SVE as an assistant professor in 2025. And so we can see the rich background that our presenters have, and we're quite excited to hear from them. So I will hand it over to them. We'll first have a presentation from Elizabeth, and once she's done, we'll have a presentation from Duncan, and then we'll have a discussion relating to what they present. As Lindo mentioned again, if you have any questions as you listen, you can type them out in the Q&A, and then we'll get to them at the end of the presentation. Elizabeth, take it away.
Well, thanks everybody, and thank you all for joining. So my name is Elizabeth Hentschel. As was mentioned, I'm currently a postdoctoral associate at the Yale Child Study Center. But when I conducted this primary data collection and conducted this research study, I was a doctoral student at the Harvard School of Public Health. And this research, which was partially funded by the SurveyCTO research grant, was really made up the bulk of my dissertation. And so this presentation today is on the development and reliability and validity of the responsive care indicator tool. So just to give a really brief background, the first 5 years of a child's life represent a period of rapid brain development, and it's estimated that 90% of the brain is developed before the age of 5. But the first 3 years, which is known as the sensitive period, is when the majority of our neural connections in our brain are formed, things that are really necessary for language and communication, and then even higher cognitive functioning. And although that process is robust and it's largely biologically driven, the quality of the brain development really depends on children's exposure to nurturing and responsive relationships. So these types of interactions and relationships are necessary to develop foundational social and emotional competencies and core cognitive skills required to communicate with others, problem solve, and maintain attention. And high-quality early interventions that promote children's healthy growth and development have been found to lead to improvements in human capital throughout the life course. So in 2018, the World Bank, the World Health Organization, and UNICEF came together and created this framework that is known as the Nurturing Care Framework. And so what this framework states is that there's these 5 interconnected components that all children need in order to develop to their true potential. And so those are good health, adequate nutrition, protection from threats or safety and security, responsive caregiving, and early learning. In this presentation, I'm going to be focusing primarily on responsive caregiving. And so to just give you all a brief definition of what we mean by that, responsive care is defined by the Nurturing Care Framework as observing and responding to children's movements, sounds, gestures, and verbal requests. A more kind of comprehensive definition that was really kind of the basis for a lot of the work that I did is that caregiver behaviors are considered to be responsive if they follow a child's behavior within a few seconds. So they're prompt, they're emotionally supportive of children's needs, they show a change from prior behavior, indicating they're dependent on the child's signal, so they're contingent, and then they're related conceptually to the child's prior action. So what this entails is the child has some sort of a cue, the caregiver observes the cue, interprets what the child is trying to indicate or say, and then responds in a developmentally appropriate way. So within the Nurturing Care Framework, there's a lot of high-quality indicators that exist that we use to track progress in children's health and nutrition. And especially in public health, which is where my background is, the majority of child development programs really focus on these health and nutrition domains. Within the United States, there's a lot of reliable and high-quality tools that are observational that are often used to measure responsive caregiving, which I defined in the previous slide. However, these tools are often not feasible for low resource settings. They often require a developmental psychologist, kind of a very controlled setting, oftentimes a lab setting, which just isn't feasible in a lot of different low and middle income countries, and also just not feasible in a lot of areas in the US as well. At the population level, large-scale surveys such as the Multiple Indicator Cluster Survey and the Demographic and Health Survey use other variables as a proxy, but the variables that they use really are not consistent with the conceptual definition that I shared of responsive caregiving. And at the program level, there's a diverse and wide-ranging set of measures, indicators, and scoring methods that are often used, but these also most often are not consistent with this conceptual definition that I shared. And then lastly, almost all of these tools are developed and validated in high-income countries, and then either adapted to low and middle-income countries or just used in low and middle-income countries without kind of adapting them to the context. So in 2020, in collaboration with the World Health Organization, I led the development of the responsive caregiving and early learning indicator tools to be used for monitoring and evaluation at the program level. I'm going to talk about the responsive caregiving tool right now, but we also have work ongoing with the early learning tool. And so based on the theoretical definition that I shared, we underwent this process of mapping out existing tools that have been used across the world by key constructs. We went through a lot of different iterations, piloting, expert review, et cetera. And when we finally had this tool, our next step was to validate it in a lower middle income country, which is where it was developed to be used. And so this tool had to be observational. It had to be able to be used in less than 5 minutes in a low resource setting. And it had to be for children under the age of 3, and then also to be freely available. And this tool is available on the Nurturing Care Framework website. So this is a summarized version of the final tool, and we decided to conduct the validation of the tool in rural Pakistan. So as you can see, there's 3 main dimensions that the tool incorporates. The first is responsive interactions, which is made up of verbal and nonverbal subindicators. The next is caregiver-initiated interactions, and the last is negative affect and action. So responsive, as I mentioned, there has to be a child cue. The caregiver has to build upon what the child is trying to indicate. And so those kind of 2 things have to be seen. Caregiver initiated is not necessarily negative, but this is when the caregiver is initiating some sort of an activity. So for example, if a caregiver says, come over here, we're going to read a book together, that would be a caregiver initiated behavior. And then negative affect and action is explicitly negative. So some form of kind of physical punishment would be an example. And so we had these examples of definitions here, which we adapted to the context, and I'll get more into that. And then our enumerators would observe over a 5-minute period and use a frequency tally for how often each of these behaviors were observed. And this picture on the right is a typical house that we visited during this training and then data collection. During the observation, the caregiver would be given some sort of a plaything and or picture. As you can see from these pictures here, all of these items that would be typically seen in a home in Nowshera-Feroz, Pakistan, and we adapted that to the context specifically. And then this is an example just from one of our trainings that we conducted in Nowshera-Feroz. So for the validation study, there were 3 parts, but kind of the key thing that was important before anything got started was our partnership. So we partnered with a local NGO that had over 14 years of child development research experience in Nowshera-Feroz, which is a part of Sindh, Pakistan. And all of our enumerators, as I mentioned, had a lot of experience, but they also were all from Nowshera-Feroz. And so there was a lot of trust among them in the community that we worked with. The next part was a qualitative piece. So as Mufia mentioned, I'm a mixed methods researcher. And so the first part was first to just understand, how is responsive caregiving conceptualized in this community? Do mothers regularly engage in responsive behaviors? And if so, how do we adapt the existing tool to include examples that are contextually relevant? And then the last part was the quantitative validation study. This is mostly where SurveyCTO came in terms of using their software. But we conducted a quantitative validation study with a random sample of 200 caregivers with children under the age of 3 in Nowshera-Feroz. And so this picture on the right is a picture that was taken during our piloting with one of actually our friends of the research team. But this, again, is like a typical home, a typical kind of observation. So the first part was the qualitative study. We conducted a phenomenological qualitative study to understand the extent to which responsive caregiving was conceptualized among mothers of young children in Nowshera-Feroz. Our interview guide included semi-structured, open-ended questions that focused on the mother's cultural and structural factors that influence their parenting and their perceptions and practice of responsive caregiving. So all of these caregivers were asked for their aspirations for their children and then how they would respond in a variety of different scenarios. So for example, we asked them, if your child is in distress, if your child is demanding your attention, but you don't have time to give them attention, how would you respond in all of these different scenarios to understand their behavior? And then we also had specific scenarios that we read to them. One that was an example of a responsive interaction and one that was non-responsive. We didn't say which was which. We just asked them to reflect on the scenario, which also gave us insight kind of to their perceptions on parenting behaviors. So once we did this qualitative study, in terms of our analysis, we found a lot of variation in the types of behaviors. So there were some behaviors that were disagreed upon. So some caregivers said that they did this all of the time, and some said they would never do this. And then there were other behaviors that almost everyone, they just kept coming up again and again. Almost everyone did these behaviors. So for example, using verbal responses to console a distressed child, praising children in front of them for good behavior, finishing work and then tending to the child's demands, or leaving work while busy to respond to the child's demands, excluding sadness, were behaviors that were really disagreed upon. So some caregivers said, yes, we do this all the time. And some said, no, I would really never do that. And then in terms of behaviors that there was high agreement, immediately consoling children that were sad, almost everyone said that they did this, changing their facial expression in response to a child's cue, engagement as a form of encouragement, and then using a physical kind of warm response to console the child were behaviors that almost all caregivers in this community said that they did. The next piece was the scenario. So here's an example of a scenario that was read to the caregiver. So Ellie is 18 months old. He's playing with a bowl on the ground. He starts to call his mom. She's busy preparing dinner and doesn't have time to play with him. She ignores him. He calls louder, walks over to her and pulls her scarf. She turns around and tells him to stop yelling, that she's busy. He starts to throw his bowl at her legs. She takes the bowl and puts it away. He starts crying. She tells him to stop crying. So we read this scenario to caregivers that had a child that was around 18 months old. And similarly, we had a lot of different responses. So some mothers that completely endorsed this behavior, some said, sometimes I would do this, sometimes I wouldn't. And others said, this is completely wrong. So I'm going to highlight just a couple of those. One mother said the behavior was right. She was busy with work. She might think that she will take him after work. I would do the same. We calm our children by scolding them, and we say, we'll come to you after we're done with our work. This other mother said, no, this behavior is not right at all. She was working, so she wasn't free. Even though she doesn't want to ignore her, she prefers her work to him and for him to be quiet. This will leave a negative impact on the child. We do good and we have good. We do bad and we have bad. And then other caregivers said, it really depends. So when a mother works, she desires to complete her work first, but sometimes we also pick our children and we leave our work. It's just up to our mood. So again, there was a lot of kind of variation in the types of behaviors that caregivers said that they engaged in. So the main takeaways from this, the first was that many mothers in this village in rural Pakistan regularly engaged in a variety of different responsive behaviors. So as I kind of mentioned before, this really suggested universality without uniformity. So there is debate in the field of responsive caregiving on if responsive caregiving itself is a universal construct, or if there are some communities in which caregivers are not responsive. And so that's why this qualitative work was so important. And what it really showed us is that although there was variation in how responsive mothers were, almost all mothers engaged in at least some responsive interactions. And the more responsive mothers were not necessarily more Western, they just had different parenting behaviors. But responsive behaviors such as kind of warm physical responses, especially to child sadness, were really regularly seen in this community. So we recommend that similar qualitative work is done when you're adapting assessments. So that was the purpose of this, to help us to adapt our responsive caregiving quantitative tool, and also when we're measuring caregiver-child interactions. And then this also allowed us to incorporate context-specific examples into the tool itself. So remember in the beginning when I showed you the tool, there was the responsive, caregiver-initiated, and negative dimensions. And then there were examples of behaviors. So because of this qualitative work, we incorporated more kind of physical response examples into the responsive behavior example section, and also the one about changing facial expression in response to a child's cue. And so this allowed us to make the tool better, and also to confirm that responsive behaviors were seen in this community. So then the next part was the quantitative data collection. And so there are three parts to this. First, I traveled to Pakistan for a month to help with the training and the field testing for the quantitative piece. As you can see, first, this training was, in a classroom. We used vignettes, and we kind of really made sure everyone understood the definition of responsive caregiving. We then field tested kind of friends and family in order to test, the tool in a real world setting. And then we piloted the tool. And so this is an example. I'm not sure if the sound will work, but this is an example of one of the interactions that we observed. So what would happen is I would videotape the interaction. I only videotaped for kind of friends and family of our research team because most people did not want to be videotaped, which is a part of the reason why we developed this tool. It does not require a videotape at all. It's supposed to be live coded. But for the kind of piloting process, I would videotape, and then our enumerators would live code. And then afterwards, we would watch the video together and talk about the different interactions. So this is one of the videos that we did. So you can see they're playing together. She's talking to her. She hands it to the mom. The mom takes that from her. So that's responsive. And so we would just kind of like talk through what the different types of behaviors were. And this is also really where the SurveyCTO software came in. It saves a lot of time when you are able to actually do the data collection with the SurveyCTO software and not have to do an extra step of using paper and then incorporate and then, uploading it into an Excel document. It saved a lot of time. And then, obviously the SurveyCTO funding also helped all of this data collection happen. So once we had all of this and we were ready to go, we then did the quantitative study, which was the random sample of 200 households. And our research question is the responsive care indicator tool valid, reliable, and feasible in a rural Pakistani setting? So there were four main things we were looking at. The first, we wanted to look at the inter-rater reliability between our enumerators, our assessors, and the field manager to see how well two independent people were using the same tool on the same observation. We then wanted to look at the dimensionality of the scale. So as I mentioned, we believed there were these three main dimensions, but did these statistically actually exist was a really important question. And then we wanted to see if that factor structure was consistent by age group. So for children under the age of 1 and children over the age of 1, did this same factor structure exist? We then wanted to look at the concurrent validity. So how well did this tool correlate with existing measures of stimulation, early learning, maternal education, and household wealth? And then lastly, we wanted to look at predictive validity. So how well did the tool correlate with child development? And so in terms of reliability and dimensionality tests, we found an average kappa coefficient, which is a measure of the agreement between the field manager and the assessors, taking into account how difficult the items are, of 0.95 on average, which is very high. It's basically near perfect agreement. We then conducted an unrotated exploratory factor analysis on half of the population, and we found strong evidence for a two-factor solution. We confirmed this on the full population, and this was our final model. So as you can see, there are these two latent constructs, responsive interactions and caregiver-initiated interactions. These two constructs are correlated at 0.17, but they're clearly not the same. These are the observed items, so the responsive items, and then the caregiver-initiated items. And these are the factor loading, so how well they correlate to this unobserved latent construct. And then these are the error terms. And so you'll notice that there's, strong evidence of a two-factor solution, very high factor loadings within each of these constructs, but there's no negative dimension. And this was because only 15 negative interactions were actually seen. So we didn't have enough data to confirm it with negative interactions, which makes sense because we're only observing over a 5-minute period. So you were probably not going to see negative interactions in that short of a time period. So that has, future implications. We found high internal consistency reliability within the factors, and then also adequate fit statistics. We also found that concurrent and predictive validity were satisfied. So we did a measurement invariant analysis, as I mentioned, looking at the factor structure for children under 1 and children over 1, and we found non-invariance. So this was evidence that maybe the factor structure is different, but when we did an exploratory factor analysis on both samples, we found that the factor structure was the same. The fit was just better for older children. And this is consistent with kind of empirical literature and what we know about responsive caregiving and parenting, which is that there's less of a difference between responsive parenting and caregiver-initiated kind of interactions for children under the age of 1 than over the age of 1. So we still move forward with the same factor structure for the whole population. We found that our responsive interactions factor was strongly and positively correlated with early learning, maternal education, wealth, and stimulation. And then we also found that it was strongly and positively correlated with child development, which we measured by using the Bayley scales of infant development. So as you can see here, these are the child development domains, and this is the responsive interactions sum score. There's a positive correlation between responsive interactions and all domains of child development, except for social emotional. There was no significant interaction. And there's a negative association with caregiver-initiated interactions. So overall, we found that the tool was reliable, valid, and feasible. I'm just going to skip this for the sake of time, but this just summarizes the results that I just shared with you. And in conclusion, we found that it was able to be implemented in under 5 minutes in a rural community in Pakistan. This can be used to determine levels of responsive care before and after implementing a parenting program, and also has the potential for larger scale intervention evaluations given how easy it was to actually use and the feedback we got from our assessors. Also, just to say that the research collaboration continues. So since we knew this tool was reliable and valid, I was able to return to Pakistan a year and a half later and help with the training for a follow-up study that we're doing, where we're trying to understand the impact of socioeconomic status on child development through the pathway of responsive caregiving, and really trying to kind of parse out how much responsive caregiving mediates that pathway. And so we were able to collect data a year and a half later to look at that. And then last thing, just to say, there's great partnerships that are already happening. This tool is already being used by other partners. So USAID's advancing nutrition work, integrating nutrition responsive care and early learning in Ghana and the Kyrgyz Republic. You can't see, it's probably quite small, but this is responsive interactions. And based on their programming, there was a huge increase in the percent of responsive interactions in Ghana and a small increase in the Kyrgyz Republic using this tool. And then also, I've been working with UNICEF to help to select items to measure responsive caregiving at the population level that are caregiver reported. So this work really has a lot of implications, and I'm really thankful for the support that SurveyCTO gave me in getting started on this. And so I just want to thank my co-principal investigator, Saima Sial, who is on the left here, and the project's research assistants, enumerators, Saima, Shaynaz, Shamim, and Zarina, and then also my research advisor, Dr. Aisha Yousafzai. And thank you so much.
Great. Thanks so much, Elizabeth. That's super fascinating. Yeah, so first of all, thank you so much again to SurveyCTO, the team, Mafia, Lindo, and everyone else for the opportunity to present to all of you today. So my name's Duncan. I am a PhD student at the Paris School of Economics, and I'm going to be joining Princeton next year as a postdoc. I'm a development economist. I mostly work on questions of discrimination. And so this project was partially funded by SurveyCTO, is a project that seeks to understand how discrimination towards a minority is affected by communication about that minority among kind of majority group members. So I really started off the project motivated by the thought that, especially in economics, we portray discrimination as something that's very difficult to change on an individual basis. And it's something that we know from, loads of different studies that it can lead to these large costs, both in terms of efficiency and equity and kind of human welfare. But so it's difficult to change at the individual level, it seems. But at the societal level, it seems to sometimes change quite rapidly. The level of discriminatory preferences that we observe can rapidly shift. So two very salient examples of that include attitudes towards same-sex relations in places like the US, where even in the course of just 1 year in 1993, that kind of approval level went up very rapidly. And if you look at attitudes towards interethnic marriage, that opposition to that kind of halved over the course of around 10 years in the US as well. So sometimes you see these quite rapid shifts in discrimination. And because that shift seems to be happening at the group level, that implies that maybe social interactions might be underlying some of these rapid changes. And while quite a big previous literature has examined what's called the social contact hypothesis, namely that interactions between a majority and a minority might underlie changes in discrimination, there's actually very little literature that looks at communication just purely about a minority, but among majority group members. And so that's the communication that I'm going to examine in this project. So this communication about a minority between majority group members. And so in this study, I studied two types of this communication and how they affect discrimination. The first I call horizontal communication, where this is really about peer groups, coming together and talking about a minority. So in this case, it's going to be neighbors coming together and talking about transgender individuals. And so why might that affect discrimination, change it, rather than just reinforcing whatever is already there? One mechanism you might have in mind is through virtue signaling. So even if I'm discriminatory, I might not want to show that I'm discriminatory to my peers. And so I might kind of bias my communication to be more pro-minority and therefore even persuade others to discriminate less. Another mechanism kind of more broadly that you can think of is about persuasion. So maybe I change other people's attitudes by sharing information or narratives or ways of thinking about the minority. The second type of communication I examine in the study is what I'm calling top-down communication. The idea here being that there are some agents of authority within society that might have a particular power to kind of change people's attitudes or behavior towards a minority. And I'm going to focus in particular on the idea that the legal system can grant legal rights to a minority. And if you communicate those about those rights to the general populace, then that might signal that discrimination is unacceptable and therefore reduce discriminatory behavior. So how do I answer these research questions? I ran a very large field experiment in South India, in Chennai, with over 3,000 participants. And in this field experiment, I'm evaluating the level of discrimination faced by a particular community of transgender women. You can think of these people as being one of the most visible LGBTQ groups in India, and who are particularly vulnerable to both kind of economic discrimination, but also violence and harassment. I'm going to measure the level of discrimination faced by transgender workers when non-transgender participants are offered a free grocery delivery to their home, and they get to select who actually carries out that grocery delivery. Some of those delivery workers are going to be transgender, and so I can measure how much people discriminate against transgender workers. And then what I do is measure the effect of a few randomized treatments on that level of discrimination. So the first, trying to evaluate the effect of horizontal communication, more specifically bringing 3 neighbors together in a group discussion, getting them to make a collective hiring choice and a collective decision over who they would like to choose for this delivery. And in so doing, they're going to communicate about whether they would like to hire a transgender worker themselves. And I'm going to measure the effect of that on later discrimination. I also measure the effect of top-down communication. In particular, this is going to take the form of a video that explains the legal rights that were recently granted to transgender people in India. I'm also going to try and understand not just what the effects are, but why I find the effects that I do, with some additional kind of mechanism treatments that tease out the role of virtue signaling and persuasion. And so to preview what I find, so first of all, I document that there is this very strong discrimination against transgender workers in a control condition where there's no communication about them. So when people are just choosing individually and in private, they are on average sacrificing around 2 times their daily food expenditure to not select a transgender worker for these deliveries. So there's very strong discrimination in private. But if that same population of people have been earlier brought together and have a group discussion with 2 of their other neighbors, after that discussion, actually discrimination has disappeared on average. So that corresponds to a 40% increase in the likelihood of selecting a transgender worker, driven by that group discussion. So people seem to persuade each other not to discriminate. I also can go back around a month later and ask some hypothetical versions of these same hiring choices. And even then, I see a partially persistent effect on discrimination. And then when I'm comparing this effect of the horizontal communication to top-down communication, the horizontal communication is around doubly effective at reducing discrimination. So the top-down communication does do some work, but it's only around half as effective. So let me tell you a bit more about the kind of context I'm working in and the discrimination towards this group. So as I mentioned, I'm measuring discrimination against this transgender community who in the local area where I'm working are called Tirunangai. This is a social identity with a long historical role in Indian society and so they sometimes take part in religious ceremonies and they're composed of what in a place like the UK we would call transgender women. Although the numbers are very unreliable, we suspect there are around 2 million of them in India. And importantly, the awareness of this group among the general populace is very high, partially because they have this historical role, but they're also very visually recognizable as a group. But at the same time, this means they face and have historically faced a lot of marginalization. That's kind of indicated by these very low rates of formal employment. And also, if you look at kind of human rights reports from the US State Government Department, for example, they document quite stark instances of discrimination and even violence. And so in that context, I have designed an experiment which seeks to measure discrimination against this group and then see what can affect it. And so to do that, I had this sample of over 3,000 non-transgender participants in Chennai, this urban setting in South India. And to allow for this group discussion, this horizontal communication, these participants are always recruited as groups of 3 same-gender neighbors who know each other day to day. And we go to these participants and we frame the exercise that we're doing as a market research survey for a grocery delivery service. And so we offer people a free grocery delivery. We ask them to make 10 binary choices over the delivery options, which in this case doesn't just include the items that they are going to receive, but also the actual delivery worker who carries out the delivery. And one of those choices will be randomly selected to be actually implemented. So we actually deliver goods to their door with the delivery worker that they select. So this is an example of one of the choices that a participant might face. So they're choosing between A and B, and they get to see the photo of the worker that would carry out the delivery. And if that worker is transgender, I test that people recognize them as being transgender almost 100% of the time. And then I also vary the items on offer across the 2 options in the pair you can see at the bottom there. And so people are each making 10 of these choices. The first 4 of those choices is where I vary the kind of elicitation process in order to get some treatment variation. And so in a control group, participants are only choosing who they prefer on their own and in private. Whereas in the main treatment group, they engage in what I'm calling horizontal communication, i.e. 3 neighbors come together and they have to make a collective choice over who they would like to hire for this delivery. And they'll all receive a delivery from that same person. And because they have to collectively choose, that means that they're going to discuss who they prefer and why. And so someone might say, I want to select this transgender person because we need to help them. Someone else might say they're unreliable and therefore not want to select them. And then I'm going to measure the effect of that communication on later discrimination in private. And so that private discrimination that happens afterwards is going to be in choices kind of 5 to 10. So this outcome round where I'm always eliciting answers kind of in private and individually. And so this is a good time to kind of flag just how I was using SurveyCTO and the kind of advantages of SurveyCTO in this study. And so in particular, because I'm using some quite complicated kind of elicitation processes and data collection processes, I made use of several advanced features of the software. So one was that all of these choices, the 10 choices people are making, were randomized. And so randomly showing different pictures, randomly showing different characteristics and items, etc. And so that's all coming from a pre-randomized database that we kind of prepped beforehand that SurveyCTO can then pull from and then show to the participant. And so that was a kind of very effective way of doing this randomization without having to do anything kind of by hand. I also used the kind of advanced feature of a field plugin that's now available on SurveyCTO, where I'm using custom HTML and CSS, so web design languages, to visually design that hiring choice where they were choosing between A and B. And then all that randomization, as I mentioned before, there's other additional mechanisms where I'm using randomization features that are built into SurveyCTO. For the discussions, I used the feature that allows you to record the audio of those discussions. So I can get kind of full transcript data, so I really know what people are saying and why. And then in addition, it allowed me to design an implicit association test, which measures the kind of implicit biases people have against certain minorities, that I was able to design in SurveyCTO, although we didn't end up using that in the final version of the survey. So all that to say, it was there were lots of features of the SurveyCTO that were very useful and kind of non-standard in this project. So let me dive into the kind of results that I find. The first, I'm going to show you the results on the effect of horizontal communication, this group discussion. So as I mentioned before, I can first find that in the control group, when people don't engage in this horizontal communication, there's a very strong discrimination against transgender workers. So this blue bar is 18 percentage points lower than the red bar. In the control group, that means that transgender workers are 18 percentage points less likely to be chosen than a non-transgender worker. And so that implies, I can do the calculation and show that implies that people are sacrificing, they're leaving on the table around 2 times their daily food expenditure to not select a transgender worker in the control group. But if on this right panel you look, there's actually no discrimination in the group that have already engaged in a 3-person discussion. And so that's to emphasize, this is choices people are making after the end of the discussion in private and on their own. And that discrimination has reduced to something not significantly different from 0. So all that's implying that this horizontal communication seems to be very effective at reducing discrimination. As I said, we can go back 2 to 9 weeks later, so in the medium run, and ask some more questions similar to the hiring choices, but we make it explicit that they won't actually receive a delivery. And even then, the discussion arm, the people that were involved in that horizontal communication, are still more likely to select a transgender worker, suggesting that there are these partially persistent effects on people's choices, with 1/4 of the original effect remaining after around a month. So this horizontal communication does lead to these large short-term reductions in discrimination, and some of that persists in the kind of medium run as well. How does that compare, though, to the top-down communication that I mentioned earlier, this information about the legal rights held by transgender people in India? So to measure that, I designed a short video that includes information about the 2014 Indian Supreme Court ruling that affirmed that transgender individuals have all the same fundamental rights as other Indian citizens as per the Indian Constitution. And so we tell people this through the video and then see how that affects whether they discriminate a lot afterwards. That video does reduce discrimination by around 8 percentage points. But it's important to note that that's only around half the effect size of the horizontal communication. So suggesting that this top-down communication can reduce discrimination, but it's much less effective than the horizontal communication in this setting. And so let me talk about the mechanisms. Why is it that I find the results that I do? I think this is important to understand because I do find, this horizontal communication leads to these large reductions in discrimination, but that kind of contrasts to work going back even to the 1970s, that suggests that communication will often tend to reinforce existing views. So if you bring racist people together and get them to talk to each other, then maybe they're going to become more racist, rather than less racist. And so why is it in my case that it kind of seems to go the other direction? I'm going to show you evidence that on two main channels that I test. The first is on virtue signaling. So maybe people are showing off that they're not discriminatory. The second on persuasion. And I'm going to show you evidence that virtue signaling does not seem to underlie the results that I find, whereas persuasion seems to be supported by the data. So to test this virtue signaling, the idea here, as I said, is that even if I'm privately discriminatory, I might not want to reveal that to my peers. So I might then, say lots of pro-minority stuff in this group discussion, and maybe even persuade people to discriminate less afterwards. But to test this, I kind of take the first part of this theory and say, okay, is it the case that people want to show off to their group that they're not discriminatory? So I test this by adding a treatment arm in which people's choices are public to the rest of their group, but they don't discuss them. And so in particular, I tell people you're going to make some individual choices, but those choices we will tell to the rest of your group afterwards. That, though, doesn't have any effect on kind of average choices, suggesting that virtue signaling, this kind of showing off mechanism, if you like, doesn't seem to be driving the results in the discussion. I do have this evidence on persuasion. And what I find here is that even if you don't take part in a discussion yourself and you're just listening to it, that also reduces how much you discriminate afterwards very substantially, basically as much as taking part in the discussion yourself. And so that implies that people are really persuaded by what they hear from others in the group rather than anything they're doing necessarily themselves, implying that this persuasion channel is important. I think there's still a puzzle, which is why is it that people are persuading each other to discriminate less, given that they seem to be privately discriminatory? One suggestive and important piece of data is that it seems that the pro-trans people, the people who are pro-minority, are the ones who kind of argue the hardest in these groups. So they are more likely to speak first, and they're more likely to kind of dominate when discussing the transgender worker. And in the paper, I also go through a kind of theoretical argument to suggest why that might be the case, which is that they might start off, the pro-trans people are kind of further away from the existing group norm, and therefore they have the greatest incentive in some conditions to try and persuade other people to change their mind. If you're already in the majority, maybe you don't need to change other people's minds. That can occur when your discrimination is kind of on average in a sweet spot where it's not too strong, but it's not too weak as well. So let me kind of sum up. I've shown you evidence that this horizontal communication, so getting majority group members to talk about a minority, can, in the right circumstances, lead to these substantial reductions in discrimination. That seems to be, partially driven by this mechanism where the pro-minority people in the groups are persuasive. They change other people's minds, and they're disproportionately vocal. And that can happen in particular when you get these attitudes in this sweet spot. I also showed you evidence that top-down communication can be helpful, but maybe in this setting is not as helpful as horizontal communication. And I think more broadly, it speaks to trying to go beyond this idea that the only way attitudes are going to change is if a person comes into contact with a minority. And instead think about, okay, this communication within the majority group can be really important for changing people's attitudes as well. And I'll leave you with a few thoughts on where this could kind of lead in terms of policy. The first is that it implies that we should kind of really design decision environments where discrimination can take place to potentially involve groups under the right circumstances. And that can, on its own, potentially reduce discrimination substantially. It implies that discussion-based sensitization programs, which have been a bit explored in the literature on gender norms, for example, could be a particularly effective way at changing people's attitudes and might be especially scalable given that just listening to a discussion can reduce discrimination. So you could even deliver this through video potentially. And that links to some future work I'm planning to do on reducing LGBT discrimination in Indian schools. And then one other tactic you could take is that maybe you want to, instead of just letting that communication happen automatically, you might want to identify those kind of pro-minority or those particularly pro-social people within a social network, identify them and train them up and maybe give them the skills to persuade others. And that relates to some related work that I've got in Madagascar in a kind of different context, looking at the stigma around menstruation, where we identify people who are willing to speak out against the taboo against menstruation and see that they are pretty effective at reducing the stigma and spreading kind of awareness of optimal hygiene practices. So that's all for me. But yeah, thank you again to SurveyCTO for the opportunity to present to you. And looking forward to the questions.
Thank you, Duncan. Thank you, Elizabeth, for your presentations. I think there was a lot in there. Right away, I think I will just ask one quick question, maybe a reflective question based on your experiences, and then we can get to the Q&A. From your experiences with this and other projects, what guidance would you offer to fellow researchers contemplating the utilization of SurveyCTO for academic research work? From your experience, what would you say?
Yeah, I can take this first. So I guess one kind of lesson I've taken away from lots of my field work is piloting a lot is always really helpful, and spending time on the field, trying out the questions that you're trying to use to measure things, because you can always imagine that things will go well, and it's only when you see people try to answer the questions that you've written or try to follow the instructions that you've written, that you see that like people can misunderstand things, or there's translation issues, or they don't understand the way you've set things out visually. And so doing a lot of iteration by spending time on the field, I think has been incredibly helpful, and kind of taking inspiration even from like user experience design in tech, the kind of tech sphere and the psychometrics literature, and spending a lot of time kind of focusing on making sure the measurement of different outcomes is really on point. And I think that like can really improve the quality of the data you're collecting.
I agree. The only thing I would add is also to do qualitative work if you can, because I think that it really allows you to understand the how and the why under what you're collecting. So
it's also the most fun part of work as well, I would say.
Great. All right. So we will get into our Q&A. Before we do that, I just want to remind everyone that if you haven't used SurveyCTO before, or if you're a current user of SurveyCTO, you can always explore the tool to be able to do and see some of the things that our presenters have mentioned here, different basic but also complex things. And you can reach out to us through our support team if you are a paid up member. But if you are not, you can also post your questions on the community forum. And if you are wondering whether it's the right tool for you, you're able to do what you want to do in terms of your research, you can reach out to Maria's contact, and she'll be able to get you started, so you can actually be able to evaluate whether SurveyCTO is the right tool for you, and whether you can do some research like what has been presented. Also, just to mention that we do have a webinar coming up later in the month. This one will be on conjoint analysis. So if you are interested, there'll be a link that will be shared, and you'll be able to register for that and join us for that. It's another excellent way to be able to do different types of research. And so we'll be able to share what's available in SurveyCTO for conjoint or discrete choice experiments. And you can keep track of us on our socials to just make sure that you are keeping up to date with presentations like this one.